G'day everybody, my name is Chris Gambin. I'm the Labor candidate for the seat of Banks. We're in Peakhurst today. I grew up about 500 metres up the road, but I'm delighted to welcome Catherine King, the Shadow Minister for Health in the Federal Parliament, and Walt Secord, the Shadow Minister for Health in the State, New South Wales Parliament, and Lucy Mannering, of course, who everybody knows is our candidate for here in the seat of Oatley. We've got a fantastic health announcement that Lucy and I have been working on for months and months. We're delighted today to have Catherine and Walt here to bring it to fruition.
Thanks, Chris. Look, it's fantastic to be here in your local community with Walt Secord and Lucy Mannering as well, and it's a great example of where state and federal Labor can work together. We're announcing today that a Shorten Labor government will invest $10 million for a Health One facility here in this community. It's a facility that will bring together general practice with state-funded community health services and allied health services. We know that many people in this area have to travel a long way to get to hospital care, to get to general practice care, and we want to make sure that here in this community we can make sure that people have access to the health services that they need. They're a great partnership between state Labor and federal Labor, and a really important facility for this community. It comes on the back, of course, of the cuts that the Morrison government has made to hospital and acute services across the southwest. We know that in southwest Sydney it's been over $7 million cut from public hospitals, and if people can't get the care that they need, can't get into emergency departments, or have to wait a long time for elective surgery, we know that their health suffers. And really what this Health One facility will do will provide some relief for the emergency departments at the public hospitals, but also provide much needed general practice services and allied health services in your community. And I might ask Walt to say a few words.
Thank you, Catherine, and thank you, Catherine, for the $10 million contribution. The state government, yes, and state Labor will work in partnership with federal Labor, and we will do the day-to-day staff and running of the facility into the future. But again, this is about working in partnership with federal Labor, and this is also about relieving the pressure on St. George and Bankstown hospitals. 30% of patients at Bankstown Hospital fall in the category of triage 4 and 5, which are the least urgent categories. And at St. George Hospital, 40% of patients there are in triage 4 and 5 categories. And these are not urgent. These are conditions and situations that should be dealt with by a GP or outside a hospital setting. They're not urgent, but they clog up our emergency departments. This also shows the pressure that the health and hospital system is under. We have enormous pressure. The doctors, nurses, and allied health workers are doing their best, but they need our support, and this is just another way we can support them. And one last observation, this is about priorities. We will invest in schools and hospitals, whereas the Liberals and Nationals are splurging on stadiums. We are going to invest in our health and hospital system and to fix the elective surgery blowout. 80,000 patients at this moment are waiting for elective surgery in New South Wales, and patients are just waiting too long in our emergency departments. So I thank you, Catherine. This is a sensible plan, and this will change lives and affect patient care.
Great, thanks.
This is a fantastic announcement for our community. We're so pleased to be here today. Chris and I have worked so hard on this together. We know that it's what our community needs, and we know that only Labor will put people first.